Good evening and welcome to the special edition of Cronkite News on Arizona PBS. I'm Ian Sachs. Thank you for joining us. Tonight, we take a look back at stories from our health team, from efforts to get small children vaccinated against COVID-19 to why pregnant women should count the kicks.
Last month, COVID-19 vaccines finally became available for children as young as 6 months old. Since then, one Arizona group has been working to make sure hard-hit communities and people of color have easy access to the shots. Cronkite News health reporter Milan Andrade has more on what the community initiative is doing here in Phoenix.
The One Community Initiative is a partnership between Equality Health and the Arizona Foundation, two groups that have been working to help fight COVID-19 in underserved communities. After the FDA authorized vaccines for infants and preschoolers, the group has been holding events in parks across Phoenix.
We have made it easy for people to find a location near their neighborhood. We took a meet me where I am approach and brought the testing and vaccine to the people. Eliminated language barriers, cultural barriers, access barriers, and focusing on education, focusing on access, and focusing on collaboration.
Since the pandemic started, many have helped the initiative distribute vaccines, but also free N95 masks and at-home COVID tests. Among them are Earl and Mary Rose Wilcox, a former Maricopa County supervisor.
Grant Park is the heart of the inner city. My husband, Earl Wilcox, and I have the honor of running it with the city. It's a joint partnership. And we had COVID shots here. First, we started out with drive-by COVID shots because nobody wanted to talk to anybody. They were all afraid. And we did about 200.
Latest Arizona numbers show that over 12 million vaccine doses have been administered, and over 62% of Arizonans are fully vaccinated. In Phoenix, Milan Andrade, Cronkite News.
For more information on upcoming vaccination events, visit onecommunityaz.com.
Activists on both sides of the abortion debate are looking ahead now that the Supreme Court has overturned Roe v. Wade. Cronkite News reporter Luke Chatham examines the impact of the decision here in Arizona.
With the Supreme Court ruling now affecting states across the country, those who support and oppose abortion are figuring out next steps.
So we already strategically navigate people as it is, but now we're going to be navigating so many more people at one time.
Most Arizona abortion providers stop services on Friday. That means those seeking an abortion will have to travel to other states where it's a possibility. But abortion supporters are concerned providers will get inundated.
They only have a handful of clinics and they can barely support their own people as it is. And now they have to take care of so many people, thousands from various states.
But while the restrictions have made things more difficult, there could be a clear path as to what comes next. A church in Texas works to transport those seeking an abortion to a state that permits it. And they say they'll continue to do so.
The patients are going through all kinds of things, that these are the poorest people in our community. They're women, they're mostly Black, brown, and indigenous women. And that they have dignity and their lives matter.
On the other side of the debate, abortion opponents celebrated Friday's ruling and pledged more support for pregnant individuals. Arizona Senator Nancy Bardo tweeted, quote, "In anticipation of this day, the Arizona legislature increased budget resources to care for both the pregnant women and her unborn child, including for pre- and postnatal care. Groups like Choices Pregnancy Centers of Greater Phoenix have long provided services to those who choose to forego an abortion, and they say they'll continue to help."
We will continue to offer free pregnancy tests. We will continue to offer free ultrasounds. We will continue, as of 6 weeks ago, to offer the abortion pill reversal.
In Phoenix, Luke Chatham, Cronkite News.
Arizona has a 15-week abortion ban that is set to take effect in September. But there's also a 1901 law that bans abortion outright. The courts may have to determine which law takes precedence.
The nation is taking a new step to help fight suicide. Cronkite News reporter Connor Cox tells us that starting Saturday, phone providers are required to make a new calling code 988 accessible to all.
The public can call or text a new 3-digit code to get connected to mental health counselors. The idea is to give people an easy-to-remember and faster way to get help.
The 988 Lifeline will provide free and confidential support to people in suicidal, crisis, or mental health-related distress 24 hours a day, 7 days a week. It will help thousands of people overcome crises situations every day. And it will serve as a universal entry point so that no matter where you live, you can reach a trained crisis counselor who can help.
Here's how this works. An old number connecting callers to the National Suicide Prevention Lifeline will stay in operation. But now, when people dial 988, they'll be connected to counselors within that network. One goal of the new hotline is to reduce interactions between those experiencing a mental health crisis and police. At the Google touchscreen, Connor Cox, Cronkite News.
Yet another shortage has hit stores. This time, it's feminine care products that are in short supply. Cronkite News reporter Milan Andrade tells us how the shortfall has led to renewed calls for what's known as period equity.
Nonprofits across the U.S. work to ensure that feminine care products are accessible and affordable for all. But the latest supply chain shortage has them worried that donations will decrease and fewer people will get the help they need. Organizations such as Go With The Flow make sure students have access to period products here in Arizona. Yet another supply chain problem, a shortage of tampons, has the group worried it might not be able to help those who need it.
We know that with students, 1 out of 5 students will end up missing school or class because of lack of access to period products. 1 out of 4 adult menstruators already has a difficult time affording period products because of their costs.
Worker shortages and manufacturing shutdowns have disrupted global supply chains, resulting in shortages of baby formula, popcorn, and now period products. Prices are also rising, with tampons going for as much as $17 a box on Amazon recently. Lack of access to feminine care isn't just a health issue. It can also affect mental and emotional well-being.
Young women can't be mentally healthy if they don't have access to food, to housing, and to the supplies that allow them to access school, and that includes period supplies. So it makes sense. It makes sense that this needs to be a part of the mental health conversation.
Go With The Flow works with other groups to ensure low-income and unsheltered women also have access to period products.
The homeless shelters, domestic violence shelters, food banks, clothing closets. When people think about donating hygiene items, they think about things like shampoo, conditioner, toothpaste, toothbrushes, but they don't necessarily think about period products. The shortage is always in existence for folks who particularly are low income and unsheltered. And that shortage is not based on a manufacturing issue or a supply issue. It's based on a cost issue.
Go With The Flow has events across the Phoenix area to spread awareness about period poverty. To learn how to donate, visit their website at gowiththeflowaz.org. In the newsroom, Milan Andrade, Cronkite News.
Our nation's youth were some of the most affected by the disruptions to daily life brought on by COVID-19. Cronkite News reporter Anna Stansfield brings us the story of an Arizona competition that helped children process those feelings through art.
Like so many other kids, 14-year-old Sophia Lynn and her 17-year-old brother Aiden struggled during the pandemic. Online school made it harder to focus. She couldn't go to dance, and he missed out on sports. Not seeing their friends was especially difficult.
I mean, our social lives are such a big aspect of why we go to school, why we do our extracurriculars. So having that taken away from us so suddenly and having to adjust is something that definitely affected a lot of our youth.
Art has been a passion for both of them since a very young age, and was something they turned to for comfort.
Yeah, I've really enjoyed drawing. It's been like a way for me to like relax when I'm feeling down. And I think it's just a great way, like my sister said, to like spread love about certain topics that you're passionate about.
With the challenges of online school in mind, an Arizona group called SEAL, the Community Engagement Alliance Against COVID Disparities, came up with an idea. The group, including researchers from Northern Arizona University, started a contest to inspire youth to use their creativity to design health messages about COVID-19. Some wrote poems or short essays. Others developed posters about masking up and stopping the spread. Others, like the Lynns, made paintings and drawings.
And so we wanted to make sure that they were involved in really expressing their wants, their needs, in their own words, and developing messaging around COVID prevention and all of the things that came with COVID-19 prevention that really was uniquely experienced by youth.
When the Lynns found out about the competition on social media, they knew they had to participate.
And I thought it was an amazing opportunity to use my skills and use my talents to raise awareness about the subject matter that is obviously very near and dear to my heart.
Their pieces, however, had very different messages behind them.
I think it really just shows the two sides to it, how there's a lot of vulnerability with COVID-19 and how we were affected and we were hit really heavily with the really stark changes. But you can also see on the other side that we also became stronger from it. We learned our lessons. We knew how to put on a brave face and recover from all that we have lost.
So I think for mine, I tried to obviously encompass like as many aspects of like the whole pandemic situation as possible. I think specifically what I wanted to highlight through my painting was like the medical professionals and the frontline workers who are putting their lives at risk for those around them.
Aiden and Sophia were among 12 winners statewide. Each gets a $250 gift card, and Seal hopes to display digital copies of the artwork at various locations across the state, including the state capitol building in the fall. In Phoenix, Anna Stansfield, Cronkite News.
The art contest might also help with research. SEAL is examining how contest submissions influenced public behavior related to COVID-19.
The Arizona Department of Health Services is partnering with an effort called Count the Kicks to combat stillbirths in the state. Cronkite News health reporter Milan Andrade takes a closer look at how the campaign would help improve birth outcomes.
Count the Kicks educates expectant mothers about how to track their baby's movements inside the womb. The effort grew out of the nonprofit Healthy Birthday, started by 5 mothers who all lost their daughters to stillbirth or infant death. During her second pregnancy, Sean Similis started having contractions and thought she was going into labor. But what happened next is something no mother should ever have to endure.
The pain and rage of losing him was, consuming for a while. It's always still emotional. My almost 14-year-old was just over 2 at the time. So, in some ways it helped that, I had this beautiful little child that I had to get up and take care of every day.
After experiencing a rare complication, Sumilis lost her baby, a boy named Zachary. 12 years later, she found her passion in helping other pregnant women avoid stillbirth.
I just made a conscious choice that I wanted to feel better, first of all, that I wanted to embrace life and I wanted to help others in my son's name.
Today, Sumilis works with a national campaign called Count the Kicks to improve birth outcomes through education, advocacy, and support. The campaign provides a free app or paper chart to help expectant moms track their baby's movements during the 3rd trimester.
That change in movement is really an important warning sign, something that expectant parents should be paying attention to and speaking up if their baby's movement changes so that they can help ensure that their baby has a healthy birthday.
The materials on the Count the Kicks website are available for OBGYNs, midwives, doulas, and other healthcare providers.
We try to reach expectant parents really in as many places as we possibly can. We also have printed educational materials that are available to order on our website.
Stillbirths have decreased nationally in the last 15 years, but Black, Hispanic, and Indigenous women are among the most at risk. Any unusual changes in fetal movement could mean there's a problem, and Sumilis says women should not hesitate to contact a doctor.
If you notice a change, any type of change in your baby's pattern, you need to be seen. Please don't wait till the next day. You need to be seen.
Healthcare providers and expectant moms can order free Count the Kicks materials or download the app at counttthekicks.org. In the newsroom, Milan Andrade, Cronkite News.
Burnout during the pandemic is a top concern for healthcare workers, and that was the subject of a roundtable discussion this week here in Phoenix. Julio Moro Rodriguez heard from a U.S. Surgeon General and the Assistant Secretary for Health about their visit with area healthcare providers.
U.S. Surgeon General Vivek Murthy is traveling the country to hear from healthcare workers. In Phoenix, healthcare providers expressed their concerns with burnout in a closed meeting. After the meeting, the Surgeon General held a press conference at the Phoenix Indian Medical Center.
We came here to learn a little bit more about their experiences, to thank the staff here
and to talk about how we can build a broader movement in our country to address health worker burnout.
Vivek Murthy says burnout is a national crisis and is a major factor in a health worker shortage in the country. 1
in 5 doctors are saying they plan to leave their clinical practice. Imagine a scenario where you break a bone or you're sick and have to go to the hospital, but you have to wait for a long period of time because there's a staffing shortage.
Dr. Claire Nechiporenko, Chief of Pediatrics at the Indian Medical Center, says her experiences in the Indian Health Service helped her avoid burnout.
You make your colleagues connections, they become family, all of a sudden, well, friends, and then they become family, and you're over at, supporting each other. And I think that was probably one of the keys to preventing burnout.
Jasmine Lopez is an experienced clinician in the mental health care field. She advises healthcare workers who are struggling to listen to their body.
Practicing mindfulness, so any type of mindfulness activities, meditation, any type of physical activity to get like that negative energy out of you. Because if you do let that stress accumulate and lead to burnout, just depending on how severe it is, like it can take a long time to get out of it.
Surgeon General Murthy also says all of society has to step up to ultimately take care of our healthcare workers. In Phoenix, Julio Mora Rodriguez, Cronkite News.
The advice isn't just for healthcare workers. Lopez reminds everyone that mental health is important and to pay attention to when you need a break.
That's it for Cronkite News tonight. Thank you for joining us. Break It Down is next. For top Arizona stories anytime, go to cronkitenews.azpbs.org.